Hey, it's Brad Perry with Kingwood Physical Therapy. Today I'm going to go into some knee rehab exercises. So we see a lot of patients after ACLs and total knee replacements and also some knee scopes. And so usually on the first day we take it real simple and do what we call almost phase one exercises. So these phase one exercises, there's about 5 of them that we'll go into. And then we'll tell you exactly as you come into therapy, we'll go into the detail of like which ones you should do. If it's all 5 of them, we'll tell you that up front in your first visit, or we might say, oh, only do 4 of those 5. But this way you can watch this video and go into all the details of each exercise, okay? So the first exercise is going to be a quad set. So what you need for a quad set is usually you need like a towel just to kind of roll it up. The quad set is going to be just tightening this quadricep muscle. So this muscle right here is called your quadricep. And as you tighten that up, it will go into, cause the knee to go into extension, okay? So as you tighten up that muscle, you'll see that muscle kind of fire up and then the knee goes straight. So sometimes after surgery, the knee is slightly bent a little bit because you've been limping on it because it hurts or it's swollen and it can't get straight, okay? So our first thing that we want to do in therapy is usually try to get knee extension, all right? And so we do that with a quad set and some other stretches, but the quad set will be tightening that up, and if you can't hit the back of the table here, it's okay, but that's what you're trying to shoot for, is trying to push straight down. And sometimes what we'll do is we'll tell you to prop your foot up a little bit to kind of clear the calf out so that you can get full extension, okay? So tightening that muscle up and pushing down. Usually we'll tell you to hold it 10 seconds, and we'll do 10 of them. And sometimes I'll tell people to do these 10 times a day, and I'm serious. So we're doing like 100 of these a day, and you don't have to do it sitting like this. You can do it standing. I'll tell my patients just to tighten up that muscle while you're standing up and get that muscle firing. So as we get the quadricep firing, we also get the knee straight. So it just kind of serves 2 purposes there, okay? So that's called the quad set, all right? Now, the next exercise we will do is a straight leg raise. So go ahead and lay down on your back. And this one, what we want is a fully locked knee. So I tell people to really lock the knee first and then lift, okay? So if you don't lock the knee, lift this up with a little, what we call extensor lag, you can kind of see how the knee stays bent, all right? We want that knee to stay straight. So we basically will tell you to do a quad set, so tighten up that muscle, now lift that leg, and we lift it to about even with this knee or so. I'm not too picky on exactly how high, but anywhere from here to here is fine. And kind of hold it for a second and then back down. So we want to control it. We want the quad to fire, lift it up slow, hold a sec, and then back down. Good. And that is called a straight leg raise. Usually I'll tell patients to do 3 sets of 10 of these, and I'll tell them to do it 3 times a day. So we're, again, trying to get to 90 of these a day, basically. So easy to do. You can do it laying down. That makes it a little bit simpler, like on the back with this knee up here. Sometimes I'll tell people to straighten both legs out and do a straight leg raise here and lift. But most of the time, we're going to have you bend the knee on the opposite side, and that way it takes a little bit of pressure off your back. You can do it sitting, but it makes it a lot tougher, okay? So that might be the next phase as we do our therapy, is say, hey, okay, try it in sitting and do it sitting, because these might start to get too easy, okay? We usually say 3 sets of 10, but sometimes if it's in a lot of pain, we don't want you in too much pain, so we might say, okay, only start off with 1 set of 10, maybe 2 sets of 10, and go from there, okay? All right, so that was the straight leg raise. Now we're going to move into the heel slide, all right? And the heel slide, what you need is a stretch strap or some kind of strap. You can use a dog leash. You can use a long sheet. Anything that's pretty firm to help assist the knee bend, okay? So there's a couple different ways that we'll do it. We'll sometimes just kind of start with assisted. And so what I'll tell people to do is put it around their foot and give it a little turn like that. We just kind of twist it up, okay? Take a hold of that. And then usually I'll tell them to go ahead and lay down when you're doing this. Okay? And then you're going to bend the knee, so hold out one here and one on this other hand. There you go. And slide the foot along the table to bend the knee. And if it's your first day of therapy, we're going to say push it to the pain and not through the pain on this one. We just want to get the knee moving, right? So we go up and hold it probably about 10 seconds or so, and then we straighten it out. And then we'll tell you to slide, okay? It's always good to do this one probably with the shoe off, or if it's not sliding, you can take that towel that you're using on your quad sets and put it there, and sometimes that will help assist the slide, okay? So usually, again, I'll tell people to do 10 of these for 10 seconds. I'm pushing it to the pain, not through the pain, taking it easy to increase flexion in the knee, okay? Sometimes we'll say, okay, you did great with the assistance, and now we don't want you to use the assistance. Now go ahead and bend the knee and slide it without using assistance here, okay? And same thing, might help it hold 10 seconds and do 10 of those, okay? So that's the heel slides, all right? The next one we're going to move to is the calf stretch. So go ahead and sit up for me. And so this one, again, is to promote extension, getting the knee straight, okay? Usually when someone comes in, they've been on crutches, their calf is probably sore, and the reason their calf is sore is because they're not getting full extension with their gait. So whenever they're walking, they're staying on their toe, and that calf is going to feel a little sore, okay? So we want to get the calf kind of stretched out, but also get extension of the knee, all right? So I'll tell them to take a strap, put it around the foot, keep the knee straight, and just kind of pull back, okay? So don't push into this strap, but pull back. So use these muscles here to kind of help fire and stretch it out a little bit. So trying to get the knee straight here. We're also trying to get a little bit of dorsiflexion in the foot, pulling it back, holding it. Usually I'll tell people just hold it about 10 seconds. And again, do about 10 of these. And we do this about 3 times a day or so. So again, just push it till you feel a little bit of a stretch, either in the calf or behind the knee is fine, okay? If it's burning a lot, then definitely let your PT know. We don't want to cause too much pain. We call this the seated calf stretch, all right? And then from the seated calf stretch, I will have people do a seated hamstring stretch to increase their extension again, all right? So I'll have someone slide over and put this foot on the ground. All right, and so this knee is staying straight, okay? This foot is usually on the ground, so you could do this in like a bed, but also you could put your foot up on like another chair to kind of support it as well, okay? And then you just lean forward till you feel a stretch in your hamstring, which is behind the knee, and holding it 10 seconds. And I'm telling people, like, focus on getting that knee straight, okay? I don't care if you touch your toes. I would rather that knee be straight than you touch your toes, okay? And so usually I'll tell them to get a little bit more of a stretch. I'll say really reach with the opposite arm as you go forward, all right? And he's got a lot of, I can't touch my toes, so he's got a lot of bent there, a good hamstring flexibility. But again, I'll hold that 10 seconds, and we do about 10 of those 3 times a day. Okay, so now what we've done is we've covered all 5 of those exercises: the quad sets, the straight leg raises, the heel slide, a seated calf stretch, and now a seated hamstring stretch. And usually those 5 exercises are great to start doing right after you've had some type of knee surgery. And so we will prescribe these to you, especially if you've come in and your knee is pretty stiff and we're trying to get a lot of extension. So, okay, hopefully that helps. And you get your knee better. All right, thanks.